This is a Bay Area Older Adults presentation, which I will call BAO for short. BAO is a nonprofit organization that improves the health and well-being of more than 50,000 adults age 50 plus each year through educational, outdoors, and social programs. This presentation and the contents of these slides are for informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Thank you for joining us for BAO's All About Strokes lecture by Sylvia Mao. Sylvia has been a nurse for 11 years with a background in ER, quality, and process improvement within hospital walls, and transitioned to community education on primary prevention by taking on this stroke coordinator role. She's seen the devastating effects of what strokes can do to a person and injuries from falling, especially in our aging population. She enjoys teaching, so this is a great role for her to share these resources with Bay Area residents. We thought this topic might be useful to this group of older adults, since this is an at-risk demographic and learning about the signs and symptoms could help save your life.
Good morning, everyone. My name is Sylvia. Thank you for having me today. So our first question asks about your age, so we can get a demographic on what the majority of the audience is. We're going to give it a couple of minutes. What is your ethnicity? This asks if you have had a stroke in the past, and a mini stroke or a TIA, which we'll talk about in the presentation, is considered a stroke. So this question asks to see what kind of knowledge you have about stroke before the presentation. There's only one correct answer. We are looking for signs and symptoms of a stroke. This is the last question before the presentation. We are asking for risk factors for a stroke. So, what is a stroke? A stroke is also known as a brain attack. We hear heart attack often, and they added the word brain attack to let people know that this actually occurs in your brain. So a stroke happens in one of two ways. As you can see the image on the right, the first one is a blockage or a blood clot. There you have in your arteries a clot in the image there, which prevents blood flow from the left to the right. So what's happening there is you are depriving the brain in that area to the right of oxygen and nutrients that's usually delivered via your blood. The other option is a burst or a rupture in the artery. And what's happening there is a burst in the artery, and you have blood spilling into your brain tissue. And as a result, that causes damage to your brain cells. So those are the two main ways that a stroke can occur. And again, it's important to know that blood is important because it helps distribute oxygen, nutrients, sugar. Every part of your body requires that. So, next slide. These are national data, facts for the US. 1 out of 5 women will suffer a stroke in their lifetime, and 1 in 6 men will suffer a stroke in their lifetime, which means more females experience strokes than men do. And then it is the #1 long-term cause of disability in the US. And as a result of that disability, it's actually pretty costly in terms of healthcare, rehab, and if you are still working, you might miss out on work. So that's where all the money and the cost comes from. Every 40 seconds, someone suffers a stroke in the US, and this is from the CDC as well as the American Heart and American Stroke Association. Stroke is the #5 leading cause of death in America, and it kills about 142,000 people a year. So nationwide, it's 795,000 strokes each year. And in Santa Clara County alone, and this is based off of EMS calls, over 3,000 calls every year to the paramedics for strokes. Now, don't worry about that. We do have a lot of people who have suffered strokes before in the past, and over 7 million people in the US still survivors, and 2/3 of those people can have some form of disability ranging from mild to severe. Now, for national data, we are seeing people under 65 years of age. There is starting to become an increase in the data for more people showing strokes, and they are attributing it to possibly stress. So risk factors that you can control. Why does a stroke happen? As you can see, a lot of the top, let's see, 2, 4, 6, 7 items on your left-hand column talks about risk factors, things you may have heard about: stress, smoking, drinking, diabetes or high blood sugar, obesity or being overweight. That also includes physical activity, high blood pressure, and high cholesterol. Those are main risk factors that you hear about for heart disease, but it's actually the same for strokes as well. So, talking about stress, everybody probably in this room is experiencing some level of stress, especially in the last 2-3 years with COVID, personal, professional, whatever the case. It's important to try and reduce your levels of stress, whether that's through meditation, whether it's through yoga, doing meetups with other people to help limit that stress. Smoking and drinking, we always tell people to try and cut back. The American Heart and Stroke Association recommends 1 8-ounce glass of alcohol a day for women is normal. If you drink over that, it's important to consider cutting back. For males, that is 2 8-ounce glasses of alcohol a day. That's considered normal. If you drink more than that, it's important to start thinking about cutting back. Diabetes, so high blood sugar. That is important to know that you should probably get screened for that if you don't know if that is something you have. Because sometimes you may have high blood levels or high blood sugar levels, and you may not have any signs or symptoms that can indicate that. So we recommend screening by going to your doctor at least once a year. Same with the high blood pressure and same with the high cholesterol. Because again, those are things that each individual may have but not know because your body isn't indicating that. Maybe you don't have any pain or any factor that would tell you so. It is important to know that high blood pressure is actually one of the main causes of strokes. So I tell people it's good if you can't get to a doctor's office, maybe if you show up to a CVS or a Walgreens, someplace where you pick up medications. Sometimes they have blood pressure machines that you can test out. So anything, it's 120/80, it's normal. And if it's higher than that, it's important to look into finding a regular doctor to see. So obesity, that is being overweight, and it's important to know that physical exercise is very important. It is recommended by the American Heart and Stroke Association, 175 minutes of physical activity in a 7-day period, in a 1-week period. Now, I'm actually really busy. I'm always working over 40 hours a week. So if you are one of those people that don't have the time to dedicate 30 minutes, I tell people maybe when you wake up in the morning and you have 10 minutes here, try and get it in there. If you have 10 minutes in the afternoon, try to get it in there. Anything to keep your heart rate up is good for you. Consider dieting. Dieting is also important because you can reduce your intake of sugar. You can reduce your intake of salt. and you can reduce your intake of fatty foods. That will help reduce some of the sugar content, some of the blood pressure, and some of the cholesterol in your system. So those are things that you can do to try and reduce that risk or lower your risk. The other 4 listed on the bottom, artery disease. It's important to know that artery disease can develop, especially as you get older. So the image in the middle, you see there are vessels there. And the top one, it's flowing 100% left to right. The second one, you see a little bit of yellow that's highlighted there. And that is fatty deposit tissue buildup. It's plaque buildup. So what's happening there in the artery disease, is what they call it, is that you are reducing your blood flow. And as a result, in the third image on the bottom, you can see that it's more likely for your blood to create clots. So artery disease can originate anywhere in your body. It can start in your heart, it can start in your arm, it can start in your neck, it can start in your leg. So an image on the far right shows you, this is a picture of someone with a blood clot in their leg, and it looks painful, it's red, it's swollen, and so definitely something to consider if you have anything like that, to get screened for it, artery disease. The next one is atrial fibrillation, and what that is it's an irregular heart rhythm. 2.7 million people in America live with this irregular heart rhythm. And it's not scary, it's just, it does, however, put you at a higher risk of developing clots. And therefore, screening is important. Like I said, go to your doctor maybe once a year, and they can do these additional testing. Same with sleep apnea, which is irregular breathing at night. Now, if you sleep alone at night, how will you know you have irregular breathing? So it's important to get this checked. If the doctor thinks that you are at risk for any of these items in the bottom 4, they will do additional testing. That is typically not in your routine care. So those are things that you can get screened for. Now, the risk factors on the right are things that you cannot control or do anything about. As you get older, you are at a higher risk of developing strokes, just because you have more of the buildup of the plaque in your system. Your arteries aren't as elastic as they used to be. There may be weakening in the walls of that. And that is normal. Gender, we talked about females more than males experiencing or having an increase in strokes risk. Ethnicity, it's important to know that African Americans actually have a higher chance of developing strokes, and some of it is hereditary. An example of it is sickle cell. And family history. So if your mother or your father's side of the family has experienced something like this in the past, you do have a higher risk of it. And of course, if you in the past have had a stroke or a heart attack or a TIA, also known as a mini stroke, then that puts you at higher risk for developing a stroke. The main takeaway message in that previous slide is that 4 out of 5 strokes are preventable. 80% chance for you to lower your risk. And if you do see your doctor for your annual once-a-year screening, it's important to know that if they decide to give you medications and they diagnose you with any of those things, that it's important to take your medicines, because even though you have high blood pressure, for example, and they give you medications, but you don't take the medicines, you are still experiencing high blood pressure. Your risk does not come down until you take your medicines. So it's important to know that medication compliance is definitely a thing. Stroke is treatable. That is the good news. The main thing about that is that you have to be fast. Be fast. These are your signs and symptoms of a stroke. They are signature signs and symptoms. So these are all sudden changes that you or someone you know may experience. And it can be one of these symptoms, it can be two, it can be all of them. It really depends on the individual and what part of the brain is affected by the stroke. So, B stands for balance. All of a sudden, you feel like you are losing your balance. You feel uncoordinated, or all of a sudden, you feel very dizzy, like you're going to fall down. You should call 911. E. E stands for your eyes. So you're watching television, or you're on the computer or reading a book, and all of a sudden you see double, or all of a sudden your vision is blurry, everything is wiped out, or you cannot see out of the side of your eyes or the middle of your eyes. Any changes in vision, you should call 911. F stands for face. The person across the room that you are talking to, or you notice that you're in the cafeteria and you're eating lunch, and someone across the room all of a sudden is drooling or has a crooked smile. That usually indicates weakness in the face. It's important to call 911. A stands for arms, which could also apply to your legs. And that is weakness in your arms or numbness. If it feels numb, it doesn't quite feel the same as the other side, you should call 911. S stands for speech. Trouble speaking. All of a sudden, you don't make any sense. All of a sudden, you find that you are stumbling to get words out, or you're slurring your speech. You should call 911. T stands for time. So time, it's important to know that time is brain. When we say time is brain, I'm focusing in this blue box. In this blue box, for every person that suffers a stroke, in 1 minute, you could lose up to 3 weeks of your memory, which is almost about 2 million neurons or brain cells. And for every 1 hour you let stroke occur, 3.5 years of your memory is lost, almost 120 million neurons. So, other symptoms that other people may experience, not a signature, but dizziness, we talked about. Confusion, they may seem a little disoriented. They are not able to tell you the date. They may not be able to tell you what year it is or who the president is. And again, variations of these symptoms for everybody. Memory issues, some people have trouble remembering. In the blue dots, those symptoms are more specific to female or women. Fainting or passing out, general weakness or feeling very, very tired, difficulty breathing or trouble catching your breath, sudden changes in behavior, you're just not quite acting like yourself. And hallucinations, I've been asked about that before, and it can be visual hallucinations, like you are seeing things that aren't there, and auditory hallucinations, you're hearing things that aren't there. That could be a thing as well. Nausea and vomiting, and then pain. Pain can happen in the head or neck. I do want to mention that this neck pain and head pain can also happen in men, but the reason I put it under the females is because women tend to experience more migraines than men do. So I often get asked, well, how do I differentiate my migraine from this headache that you're talking about? This headache, for everybody who has had a brain bleed or a burst in a burst of their artery in the head, this headache is the worst headache of their life. That will usually be the term that people say. So your migraines is your normal. And if you experience this type of head pain, it is different and it comes on very suddenly. That is the main key. So this slide is pretty busy, but do know that there are the two types. So in your top, you have the ischemic stroke, which is your blood clot or the blockage. It happens in 87% of strokes. And for the burst or the break, that happens in 13% of all strokes. So I'm going to skip to the bottom. What is a TIA? So we mentioned that earlier, TIA, or a mini stroke. It's important to make note of this because a mini stroke is also known as warning signs. The difference between a TIA or a mini stroke versus a real full-blown stroke is that your symptoms can go away. It can go away within minutes up to 24 hours. So a lot of times people will go back to normal and they're thinking, oh, I'm good, I'm normal. But it's important to note that people who are diagnosed with this TIA or the warning sign, the next 90 days after experiencing this, they are at a greater risk of developing strokes. It's actually up to 25% of these individuals can experience that. So it's still important, if you do have any stroke-like symptoms, to go to an emergency room and get checked out. Your treatments of care, they do the same thing as if you were a stroke. They will get a CAT scan of your head. They will do all the blood work that's necessary. They'll check out your heart. They'll check out your blood pressure and all the stuff along with that, just to make sure and find out what is the cause of those symptoms, even though they went away. And usually they find some sort of underlying issue. And oftentimes people find out like, oh, I have a history of this irregular heart rhythm or whatever the case. They'll find it and they can treat it. So the gold box or the yellow box is our gold standard of care. Do know that in Santa Clara County, all hospitals can do this. If you are one of the 87% of the clots or the strokes that happen due to a clot, every individual gets up to 4.5 hours to go to the emergency room to get this treatment. Now, of course, the earlier, the better. So in these centers, if they find out you have a blockage or a clot, they can give you this medication called IV-TPA, which is a fancy word, but the medicine goes through your veins and it will dissolve the blood clot. Once the clot dissolves, blood flow will slowly restore to the other parts of the body that wasn't getting the blood in your brain. And so that is the standard of care, and that is what we are aiming for. Now, for people who are beyond the 4.5 hours, what do you do in that situation? So there are other hospitals in Santa Clara County, and the paramedics, when you call 911, the paramedics will take you to these centers if you are beyond that 4.5 hours. And what they will do in these centers in the blue is they will do endovascular procedures. They can do a procedure that goes from your groin and up through the artery to your brain and find that clot and remove it. So that's one option. If you are the 13% of people who have the burst or the brain bleed, they can go in and stop the bleed. So people have asked me in the past, how do I know which hospital to go to? Do I go to the yellow one or do I go to the one in the blue? And I tell them, you call 911 because the ambulance will determine the appropriate hospital to take you to. Here we have an image from the National Institute of Neurological, Disorders and Strokes. And here is a picture of an MRI. So the picture in blue is what we are aiming for. Blue is normal brain. As you can see, the top image has green, which is the area that is deprived of blood or blood flow. And this is for someone who has 1 hour of onset of symptoms. This person goes to the hospital appropriately. Their re-image of their brain shows that all of that green has mostly been restored back to normal. Blue is normal. If this person doesn't go to the hospital, the areas in green can become permanent. And when it becomes permanent, as we talked about those brain cells dying, those symptoms will get to the point where it becomes more severe, and that's why people live with permanent disability. So again, we are striving for early treatment because early treatment will prevent this long-term disability. So what you need to know from this is that stroke happens. It happens to anyone, regardless of age, regardless of race, regardless of sex. And time is brain we talked about, and knowing the symptoms of BFAST. So, and it's important to call 911 if these changes happen suddenly. I am part of the Stroke Awareness Foundation as well. We do have an app for your smartphone, either your Apple phone or your Android. So through your Apple Store or your Google Play, if you type in the word stroke awareness, or you use this QR code, you can download this app entirely free. So you have your BFAST with you at all times in your pocket, the signs and symptoms. And this is the main screen. You have your signs and symptoms in orange. In the blue is your emergency contacts, and you can put up to 6 people in there. The green is your nearest stroke center. It will let you know where you are in proximity to the closest stroke center, and it works nationwide. So if you were traveling, you were in Southern California, or you went to, I don't know, Chicago or something, you would still be able to utilize this app. When you hit the call 911 button in the stroke app, remember we talked about speech difficulty or trouble getting your words out. If you hit the 911 button in the app, you don't necessarily need to speak. You would still be able to call them, and they will still be able to track where you are and send you an ambulance. If you hit 911, you also send an automated text message to the people in your emergency contacts, letting them know you're going to the hospital. So that is one of the benefits of this app. A 100% of you clicked all of the above, which is the correct answer. So I'm very proud of you all.